Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome, everybody. Welcome back to the Medical Collective. I'm always glad to be here, but this time I'm more excited because we have a special guest, and I think something we need to talk about is DNA testing and counseling. Now, I asked my husband before the episode, what is one question he would ask? And he gave me the answer I was wanting. And that is, why do I need testing? I don't have any genetic problems, which we don't know, right? But I think it's important we start with the one-on-one of DNA testing and counseling. And what better way to do it with Dena DNA. Hey, Dena DNA, how are you?
Hi,
I
good.
love
How
your
are
name.
you? Thank you.
And let me tell you guys something before she introduces herself. We met on another app called CH or Clubhouse many, many moons ago during the pandemic, and I thought she was just amazing. So I'm glad to finally have her back and see her face to face.
Yeah, I know. Is this the first time we're face to face?
It is. It is. This is funny.
Oh my God.
So on Clubhouse, everybody, it's a picture and then just a voice, like you all are listening to us. We didn't get to see moving faces or any of that on that app. So this is actually seeing us, not a still picture.
It's so funny because I feel like I definitely have seen you before, but it's probably just from like watching your videos, you know?
Yes, but now we are meeting
It's so
up.
funny. Yay.
So Dena DNA, explain to people what exactly you do. It's so important.
Okay, so I am a board certified genetic counselor. So that means I am an allied healthcare professional. So I have a master's degree in genetic counseling, and that involves both medical genetics as well as psychosocial counseling. So it's learning how to use genetics and integrate it into somebody's healthcare in a way that is going to end up being the best and most appropriate for each situation, because everybody's so different, every family's so different. So that is my background. And I worked in clinic for a long time. I've worked in telemedicine. I've consulted for different tech companies in the genetic space. And then I became a content creator. So I do both social media genetics education as well as see patients through my private practice.
Well, that's great. And you guys, if you do check her on IG or social media, I will put it below in the show notes. But if you check her, she's very entertaining. She does everything very well. I love it. So the first thing I guess we should start with is, what is genetic counseling and testing? Because a lot of people don't know. What do you do? A lot of people don't think they need a genetic counselor. And I think more people do than don't.
Yeah, definitely. So I kind of like to answer this by explaining that genetic testing on its own is a really large category of testing that spans healthcare, but also things like ancestry testing and forensic, right? So our genetic testing is simply just testing our genetic material. And that can be a lot of different types of tests. It can be in a lot of different situations. But in the healthcare setting, we can see that prenatally. So when somebody is pregnant or before they become pregnant, there's different testing to do. In the pediatric clinic, if a child has a rare disease or an undiagnosed condition or a whole bunch of medical issues, autism, epilepsy, cerebral palsy, all of those, there's a lot of times a genetic cause for that. And that could be either inherited or it could be a new change in that child. And so by giving them a diagnosis, we can help them get much better and more personalized care. And then there's the adult settings. So that's like the cancer setting, the cardiovascular genetic setting. And then there's genetics kind of integrated throughout lots of different specialties, neurology and like renal and urology. There's all these different areas where we can use genetic testing. So typically we need to know what we're testing for before we know what the best test is. And so genetic counselors are there to help families, we take a full family history, personal history, and we help them understand what their options are for testing and what testing can and can't tell them. So genetic counseling is really the conversation that happens before an actual genetic test. And sometimes people will come in for genetic counseling that actually wouldn't benefit from genetic testing because whatever they have is not something we can detect on a genetic test. And so sometimes just the counseling part is kind of talking through recurrence risk based on other data, or talking through something in their history that they're concerned about. Sometimes it's combing through these feelings of anxiety or of guilt because of something that's in a family. So the counseling usually can happen before and after a genetic test. So after is going over results, but in some cases, it just happens after. And so there's different models of genetic counseling, but the counseling itself is really everything surrounding the test. And then the test is very simply just a collection of either blood or saliva or whatever tissue we're looking at, and then sending that to the lab. And the lab analyzes the sample to look for whatever it is we order. So the test is very different from the counseling. And so, so there's just a lot of different situations where genetic counseling and genetic testing, they'll go really well together. But at any point, at many points in a person's life, they could benefit from both of those things.
That's a great summary. And I think one of the good case scenarios is with cancer. And people may ask, and I will ask you, well, when will I get access to a genetic counselor? Will it be when I get a cancer diagnosis? Is one of the ways.
Yeah,
right?
We hope that people can get access before. So typically the way our traditional model works in our healthcare system, at least in the US, is that if somebody reports to their doctor or healthcare provider that they have a family history that looks suspicious, so let's say they had a relative that had cancer at a young age or more rare type of cancer or multiple cancers, then we hope that they would get referred to a genetic counselor, and then we go through their family history, again, their personal history, and we can use that to help them understand their risk before they develop cancer. That's the ideal scenario. Now, unfortunately, it's not really the realistic scenario in all cases. And so one of the reasons I'm on social media is to educate people about this option to do preventative genetic testing, right? Because it really is available if you know to request it. But a lot of times people will fit criteria where they should get it covered. It'll be covered by insurance, and they should easily be able to get in. But if nobody knows that or recognizes that, then they may not refer them. And so that happens a lot. There's a lot of missed referrals for people who really should have been referred to genetic counseling. Now, then there's the people that have been diagnosed with cancer, and there's going to be more of them that do end up getting genetic testing, just because it's also, so there's the germline genetic testing, which is testing the DNA that we are born with, the code we are born with, to see if someone was at an increased risk for cancer. But then there's also tumor testing, which is looking at just changes that happened within that clump of cells, and it wasn't inherited. And that is becoming more standard of care in cancer because it helps the oncologist really personalize the treatment for that cancer. And so because that's becoming more standard, so is the germline testing. And so a lot of people are only getting it once they come into an office and are diagnosed with cancer.
Yeah.
But really the whole goal is to try and catch them before they get diagnosed, so that we can catch it early, people can understand their risk, and we can, if there are ways to lower that risk or prevent it altogether, that's our goal in genetics.
That's important. I was thinking back to a conversation we had years ago, and I didn't even know that the cost, first of all, that insurance can cover it. And I think a lot of people get scared and think it's going to be some big $1,000 bill. And you were telling me sometimes it can be as low as a couple of $100s.
Yeah,
if insurance doesn't cover it.
Exactly. So if insurance covers it, it's typically covered, of course, depending on if someone has a deductible and the copay and all of that. But if it's not covered by insurance, then you can ask for the cash pay rate. And at most major laboratories, that's $250. So a large comprehensive, high-quality medical cancer panel costs $250 with the patient cash pay rate. So I always tell people that cost should never be a barrier. There's also financial aid. So even for that $250, which is a lot for some people, there's a lot of financial aid available at many of these labs. And so again, yeah, cost just shouldn't be a barrier because there's so many ways to get around that cost issue.
So true. If you were to give me a couple of myths or misconceptions that people have about genetic counseling, what would that be? Including the myth that my husband said that he doesn't need any testing. He has nothing wrong.
Yeah, I mean, that's the thing is that a lot of what we do is preventative. So when people come in, a lot of them don't have anything wrong. Usually it's people trying to understand what their risk is. So I'd say like that's definitely a myth. No, so I'll give you an example. So for instance, in the reproductive setting, we want everybody to get carrier screening. And what that means is we're looking at genetic changes that someone doesn't know they carry because it doesn't affect them. But if they match with a partner who carries the same disease, then they can have a child with a very severe disease. And in these cases, because that inheritance is what we call recessive, we don't see it in family history. So nobody would know, you would never know you carried it unless you did a genetic test. And so that's just an example of how testing can be so important even in the healthiest person in the world, right? We all carry a number of different mutations as humans. That's just what happens. And sometimes it doesn't affect us, and sometimes it can. And so sometimes we don't have symptoms, or sometimes we have symptoms that don't really make, like, nobody's connecting to them being genetic. So I think I would argue that, yeah, everyone at some point in their life would benefit at some point, right? It's different situations, but one of the biggest things I think is carrier screening that I think everybody should be doing. And then there's also, most of the people who have these inherited cancer syndromes and cardiovascular syndromes don't actually know that they have them. And that can be because they don't know their family history very well. Their relatives didn't get good health care. They were very close-lipped around, what they shared. Or they're adopted or donor conceived, or the parent or whoever they thought was their dad wasn't truly their dad, right? Non-paternity. All these are reasons that somebody wouldn't really truly know their family history and therefore wouldn't know that they actually had an increased risk for a certain disease. So a lot of people are out there walking around with these high-risk genetic syndromes that could be taking more medical intervention that's personalized for them, but they can't because they don't know. So a big part of why, again, another reason I'm on social media is to really spread this awareness so that if somebody is very motivated to make sure they live the healthiest life possible, that genetic testing is part of that.
So important. So the misconception would also be that you don't need testing if you don't have family history, which is not the case, you all. Not the case.
Yeah. And of course, people with family history, we definitely want to, insurance will prioritize that, right? You have to fit your insurance criteria to get it covered. So that's for people with family history. But exactly what you said, you can still have one of these syndromes without a known family history. Yeah.
That's a good point. So we're getting into now months where there's a lot of cancer awareness months. And for me, I know people are like, I want to talk about this cancer all the time, but it's the same thing with Valentine's. Sometimes we need a little bit of special care, and we need a time where we give special awareness to cancers like ovarian cancer awareness. Right now, it's gynecological cancer awareness month. It's prostate cancer awareness month, many different cancers. So when we get into cancer awarenesses, what are some things that you can tie into that, like around prostate cancer and gyne cancer with genetic testing?
So I'll tell you this. So for ovarian in particular, it's one of the highest rates of hereditary causes out of all the cancers. So there was a large study done of all these women who had ovarian cancer, and they found that about 24% of them had an inherited genetic syndrome that had put them at risk for ovarian cancer. 24%? Yeah, so 1 in 4. Right? Wow. It's like one of my favorite studies because it was so eye-opening for the cancer community. And so that is one of those cancers that anyone who has a first or even second degree relative with ovarian cancer and that relative hasn't been able to be tested because maybe they've passed, that patient should get genetic testing with a panel of genes associated at minimum with the genes associated with ovarian. But really now, because of the price of panels, we can do all the cancer genes at the same time. And so that's something that's really important for ovarian cancer. For uterine cancer, it's going to be less often something associated with a hereditary cancer syndrome, but there is a syndrome that's actually the most common cancer syndrome called Lynch syndrome.
Yes.
And if somebody has lots of uterine, colon, or other GI cancers, and ovarian's part of it too, if someone has those in their family, it's really important to be tested for Lynch syndrome and then some of the other genes associated with the cancers in your family, because I think the statistic is like only 2% of people with Lynch syndrome know they have it. And there's a lot of intervention we can do, including earlier and more frequent colonoscopies, aspirin therapy that decreases certain Lynch cancer risks. There's certain cancer treatments that work better on tumors that are associated with Lynch syndrome, and a bunch of other things that we can do to prevent or lower the risk. And so that's with uterine. If we're seeing earlier uterine, multiple cases in a family, along with those other cancers. For breast cancer, we know about 10 to 15% of those are hereditary. And so a lot of the cancer kind of community is really moving towards testing everybody with a panel. And of course, you have your BRCA or BRCA genes that everybody knows about, but there's a whole bunch of other ones too. Yep. Mm-hmm. Yeah, PLB2. And then there's ATM and CHEK2, which are a little bit lower risk. And then TP53, which is more rare, but can cause this other syndrome that is associated with a lot of different cancers, and a whole number of other genes. And so we want to make sure if someone was only tested for BRCA1 and 2 because they had breast cancer, that they expand their panel, they update it to look at these other breast cancer genes as well. And then for prostate, we also know there's a whole bunch related to prostate. Now, prostate cancer is really common, so most of them will not be hereditary, like caused by a hereditary genetic change. But the ones that tend to be more aggressive and need more aggressive treatment. And so it's really important if someone has prostate cancer to know if they have one of these cancer genes, because it will really inform their treatment and change the treatment. So that's a little bit about each of those cancers.
And that's important. It's like having a playbook for a game. I think the more information you know, and genetic testing and counseling is part of that, the more you can attack the other side.
Exactly.
And we've got to win with cancer.
Yes. And I love that, the playbook. That's such a good way to talk about it. And the thing is, like, this information...
It's football time, and I'm getting in my Dr. Sharon. It's football time. I'm getting in my Chiefs mode, but go ahead.
I love that. Yeah, I think and it's so hard, by the way, to know all of these plays in the playbook because it's always changing. Genetics is ever changing.
That part, which reminds me of the 5 years. If you can remind people that they think one time you get genetic testing and done.
Oh, yes. So your genetic code that you're born with doesn't change, but the genes that we look at, and the way that the knowledge we have about our genetics does change. So new genes are added to the panel every year or every other year. And so what I usually tell people is if they got a negative result and they still have a suspicious history, that they should get retested. I usually say to reach out to the person that tested you every 5 years to see if your panel is still up to date. And then they can order a bigger panel if that makes sense, which is another benefit of working with a genetic counselor, because we can follow our patients over many years and make sure that their testing, remains updated.
I think that's the important thing about having you as a genetic counselor people don't understand is sometimes we forget our own annual appointments, right? It's not until the doctor calls to remind you. So you need a genetic counselor that's keeping a date for you. Because I don't think anybody, even me, I know it's been over 5 years since I had my genetic testing. And I'm high risk. I've got multiple immediate family members with breast cancer and other cancers. But I don't think I would be thinking about it unless somebody called me to remind me. So I hope that we can normalize that, to be honest, more. Because I don't think a lot of doctors are thinking like that.
Yeah, and it's not necessarily something every genetic counselor does. Like, we're not typically keeping like a log. It depends if you're at a major medical center where they are doing follow-up research. That would be different. But I think sometimes it does have to be on the patient to recontact. But
That's hard.
I know.
We got to
It's just
change that
hard.
Dena DNA.
I know. Well, I think that's the thing. That's like a benefit of being part of a long-term follow-up study, because they do typically keep patients in mind over time. And when I worked at UCSF in San Francisco, we did reach back out to patients who had a history that was suspicious of a new syndrome when a new syndrome was discovered. So they were able to do that, but that's because they were part of a long-term follow-up study. So I guess if you're interested in that, that's a lot of major academic medical centers will have those.
Okay, great. Okay, I have some practical questions for you, but I'm going to start with my own. And I thought about this as we were speaking, and that is getting genetic testing through a genetic counselor. Is that the same as me going to a company and self-ordering my own test? Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation.
Great question. Not at all.
I know the answer.
There's a few different categories. So we used to think of it as like more medical grade testing, where you have to go through a medical professional to order a medical grade test, and then direct to consumer, which is exactly
DTC.
what it says. DTC testing, where the consumer purchases the test and there's no involvement by a medical professional. But then there's also kind of a hybrid category called patient-initiated testing, where a patient can order, and then a healthcare professional is kind of the middleman and can review the case, and then the testing can get ordered, and then the medical professional will call out results. And so that's kind of like the genetic community answer to these direct-to-consumer tests, because it's kind of allowing patients to take that control into their own hands, but in a way that involves medical professionals. So there's different companies that will offer that. So something like Color Genomics or Invitae will have those versions of testing. That is going to be a very different category. But when you think of things like, 23andMe or Ancestry DNA, the technology that's used and I'm saying at this point in time, they have traditional products, and then some of them are kind of moving more towards the health side. So I'm not talking about that because that's kind of a newer thing. But with the traditional product, it's what we call SNP-based testing. So it's really only looking at a few bookmarks along the genes to look for some of the more common changes, but it's not sequencing the gene. And so when we're talking about ancestry, that's totally fine, because when we do ancestry testing, we want to identify those specific bookmarks to be able to categorize a person's, geographic origin or of their ancestors. But when we're talking about health, we want to know if the gene is actually functioning or not. And in order to do that, you have to read through the whole gene and look for pieces missing or added or any spelling mistakes. And so the type, that SNP testing I was talking about, those bookmark tests, are not adequate for health, because you're not actually learning about the function of the gene unless that bookmark is like the specific change that they're looking at. So you can imagine a gene is thousands of letters long, and they're only looking maybe at 3 of those letters. So it's really not a comprehensive test. None of those direct-to-consumer tests are comprehensive. Now, there are also tests that will call themselves like genome sequencing tests. And the thing is, when you see like direct-to-consumer ones, when you sequence
these are not
a genome,
all FDA approved, are they?
Right, yeah, right.
That too.
And so a lot of this is data mining. And the thing is, there's a lot of issues with this. So one is when you do a genome sequence, or when you do any sequence, you're going to find a lot of variance, because as humans, we have a lot of variation. And in a medical setting, there are variant scientists. So these are like PhDs that will comb through this data and will use all these internal algorithms to understand what they're looking for and what could actually be associated with the disease in question, let's say, or with whatever it is in question. And so that would be this medical test. Whereas with the direct-to-consumer tests, all you're getting is like 100 random data points, and there's no one to interpret that for you. And so it's very
kind of
confusing.
like people are ordering their own labs now or going to any lab test now. And I'm sure my colleagues will be shaking their head. It's not the same thing. When you have a physician or have me, when I get a pathology slide and I know what I need to order, I'm not just randomly ordering things. It's different.
Yeah.
It leads to erroneous results. It also streamlines time and saves money when you have a professional looking at it. So
absolutely. Yeah. And that's like just the basics, like of basically like don't order a random test because it's on sale when it's not, it's first of all, it's missing what you probably need. And then it's giving you things that don't make sense and may cause anxiety. There's so many things about that. But then there's also like people will take their raw data from these direct to consumer sites and they'll upload it into this, there's a data mining software where you can look at stuff. Oh yeah, it's really common. And what happens with that is not actually regulated at all. So people will get positive results for something and they'll come into clinic. When I was working in clinic, I had a few cases like this where they thought they had Lynch syndrome, the syndrome I was talking about earlier. And then we actually did a medical test and it was negative. And yeah, and then there was a big paper that came out that showed that 40% of the findings in this community of people who had positive findings on this software it was a 40% false positive rate.
A 40% false positive?
Yeah.
Go through a genetic counselor, get the medical grade testing, please.
Exactly. And so I wonder how many people are using that to make medical decisions. It's awful.
It's scary.
Yeah.
And I guess that would be my second question is what happens to the DNA data, ethical and privacy concerns when we're going through a genetic counselor?
Yeah. So I'll say this. So there's, first of all, everything that we do in order is like protected under HIPAA, the privacy laws. And all these laboratories that are medical grade are also there. It's the same type of security as somebody giving a biospecimen for any other reason, and I'll admit, I don't know every little detail about how secure a hospital system biospecimen, you may know more than I do.
I haven't heard of a leak in our laboratories. No.
Yeah. Well,
we don't
and
do
actually, here's the thing. Epic has had hacks like many times across the country at the medical, the electronic health record. A lot of those will have leaks or hacks or things, and they just don't make the news, but it definitely happens. Like my mom's a physician and the health system she worked for had one and they were down for a while, and I've heard of other things happening. So like nothing is ever 100% secure, but it's very secure, right? When it comes to medical grade. When you're talking about direct to consumer,
and
like you were saying,
they're actively leaking data. They're actively sharing data, right?
Some of them, yes, some of them are. And then some of them are easily hacked. And some of them, you have to read the fine print because when you consent to giving your data, they're actually like in the consent, it says they can use it for whatever. Now, so, what I usually tell people is that if you're worried about privacy, that you should talk to whoever's ordering the test, and you can talk to the lab that they're sending it to, and you can ask the laboratory what their, privacy rules are. But I think personally, like if you think about it, because every center's different, every person's different, we can't like blanket generalize that every lab and every hospital system and every healthcare system is using the same security. So I think if you're somebody that's worried about that, it's worth talking to your provider and just making sure that, everything's secure. But as long as something is, covered under HIPAA, it's pretty secure.
Okay, great. You answered this before, but I'm going to ask again. Can I request genetic screening on my own?
Yeah. Okay. So there's a few ways that I usually tell people if they're interested. So there's that patient-initiated testing. So that could be either doing it through one of those companies or through a research study. So for instance, All of Us, it's a federally funded program that's allowing kind of like this general population screen. So it's not based on an indication or symptom, but it's like looking at some common hereditary conditions. So if you were just interested in a general screen, that could be really good to be part of that research study. And there's a bunch of them at different health systems, depending on what health system you're part of. So there's the general screen, but then there's also the more like symptom-based or indication-based genetic counseling and testing. And with that, you can self-refer. So you can like call a genetics clinic and explain to them kind of what you're looking for. And if you're somebody who would fit criteria for their typical patient, then you can self-refer, or you can ask your doctor to send a referral for you.
Okay.
So yeah, so it's just a way to, request this. You request that your healthcare team can send you through this workflow. So that's usually a really great way to do it if it's not being automatically done. But if you're just talking about doing like a general screen, there are a number of different services out there. Oh, another one would be JScreen, which started so it started out as a way for people of Jewish ancestry to get carrier screening, but then it expanded to not just people with Jewish ancestry, but to everybody, and then they expanded to cancer. So now it's something that anybody can just request on their own, and they actually use a very good medical grade panel, and they have genetic counselors involved in the process. So that's an example of this patient-initiated testing. And then there's a company called Genome Medical that you can actually go to on your own and request a genetic counseling session, and then they'll talk over what you're interested in and like why you want genetic testing, and then recommend the best test for you. And sometimes I think they'll order it, or sometimes they'll give you something to bring to your doctor, just depends. So there's a lot of ways to really self-refer. And then there's also seeing a private practice genetic counselor. So I have my private practice. I get a lot of people who are just curious about their health, and I do a free 15-minute consultation. And usually if it's something that genetic testing could help with, or genetic counseling could help with, then we'll go on and do a full session. And I have colleagues across the country that also have similar private practices. So there's a lot of ways for somebody to request both genetic counseling and genetic testing on their own.
Okay, and I have a question about that. If they do try to do it on their own, or the patient initiated, is that covered by insurance, or are they going to have to pay out of pocket?
Depends. It depends on which program. So, like JScreen, for instance, there's like a fee, but then it's covered by insurance. Like the rest of the test is covered by insurance. And then with All of Us, because it's research, it's free. Yeah. And so it just depends on where you're going.
Okay, great. One last question for you. What if I have a mutation? Then what?
Well, that is one of the best reasons to see a genetic counselor, right? Because that's what we specialize in, is helping our patients understand what that means for them. So first of all, we would look at the actual variant we would look at the gene, the variant in the gene. We'd look at all the literature we know about that. We'd look at all these national guidelines. And we would use all that information and incorporate it with your personal and family health history, your age, where you are in life, and help come up with a medical care plan for you. So there's a lot that we can do. Of course, it depends on the gene. So like I mentioned earlier, if it was something like a Lynch syndrome genetic mutation, or we call it a pathogenic variant, really, or a disease-causing variant. If somebody has that, then we would look at all of that information together and help them get access to that earlier and more frequent colonoscopies, the aspirin therapy I mentioned. And then sometimes there's upper endoscopies. There's a whole bunch of other screenings. And in some cases, there's a recommendation to remove organs that are at risk, like the ovaries once you're done having children. Or if someone's at a really high risk for breast cancer, they can choose to have a preventative mastectomy, or they can choose to do a lot of screening, extra screening, earlier and more frequent, and with different types of imaging techniques. And so really, it's very situation dependent and very dependent on the gene and the family history for us to customize that recommendations plan. And so the short answer to that, what if I have a mutation, is there's a lot of us genetic counselors out there that are ready to help you if you do have a mutation.
I love it. So that is why you should do either patient initiated with a counselor or go directly to your physician and ask for that guidance, because
for the referral. Yes.
Yeah, for the referral, because answers, you can have all the answers. If they're sitting in a book and you don't know what questions they go to or what you're going to do after you get those answers, it's futile. So that's why you need a genetic counselor. So thank you for that.
Exactly. Yeah. And I will say that, I know, and you could probably attest to this, like a lot of, because genetics changes all the time, a lot of physicians actually don't feel as comfortable interpreting genetic test results. And that's why we're here, right? Like our role in the healthcare team is to aid somebody's physician in translating and interpreting these results and what that means for their patient, right? So we are here for that purpose. And so a lot of people don't realize that their doctor may not be able, like if they bring in a long genetic test report, they may not be able to like fully have the confidence to interpret that. And again, another reason why, working with a genetics professional is advisable.
Great point. You mentioned the patient-initiated testing. What other advancements do you see as far as we get into public health and genomic medicine? Because there is a lot, and I can tell you, even with pathology, there is. And it's exciting. Yeah. It's more of what a personalized care.
For sure. So one of the biggest things that I'm a huge advocate of is population health screening. Oh. And so what that means is instead of somebody getting referred because they trigger a criteria, like let's say they have a strong family history of cancer, so they get referred to the cancer clinic, if they even get referred, because we know many of those systems that doesn't happen. But with population testing, every single person that comes through the door of a medical system is offered a general panel. So not just cancer, but like cancer and cardiovascular and other conditions that are common in the population. So the goal here is to eliminate that barrier of knowing that family history and to allow everybody to have equal testing. And that also allows us to learn more about these conditions because there's more people that have them than we once thought. And we're not just studying high-risk families. And so if everybody has access to testing and it's paid for in some way, then we're going to catch a lot more people with these syndromes and be able to take those preventative actions and prevent so many more diseases if we offer it to everybody in a health system. And so there's a number of healthcare systems that are doing this population-based screening throughout the country. And they're finding that many people who would not have otherwise been referred are actually coming back positive for conditions that we call clinically actionable. So there are clinical actions to take or medical interventions to take for those patients. So I think in public health, that is the most exciting kind of innovation in just the way our health system works, to be able to offer more testing, and it really makes it more equitable for a lot more people. So that's one of the ones I'm more excited about.
I am too. Are there any specific tests that they're focusing on? Are they doing colon cancer, breast?
Usually, yeah, it just depends on the health system because they all have a different number of genes, a different panel. I'm assuming that as time goes on, like they'll test more and more. So that's, by the way, that's only looking at germline genetics. So when I was talking earlier, that's the genetic code you were born with that got passed down from parent to child. But then there's also, when we talk about just genetics as a whole, there's some other really exciting uses for genetics. So for instance, like cell-free tumor DNA, which is looking in the bloodstream to see if there's any circulating tumor DNA, which can detect cancer at a much, much earlier stage than our typical imaging procedures do or other screening. So that is another way to use DNA. It's a very different technology, a different type of DNA, because it's not the inherited syndromes, but it's still genetic. It's still technically, DNA testing. And then there's also in the prenatal setting, if anybody's had a baby in the last 5 to 10 years, there's the non-invasive prenatal screening. And that is looking at the fetal DNA in mom's bloodstream to detect extra or missing chromosome, like specific chromosome abnormalities. And that is helping really screen a lot more people to see who then needs further testing for some of these chromosome issues. And so that's what everybody thinks of as like the gender test, but it's actually, it was developed to do more than just that. It was looking at some of these more severe syndromes. So those are all different ways that we're using genetics in our healthcare system. And there's so many more that are coming out on the horizon, especially in the cancer space and in possibly in the cardiac space. And I think that it's really booming right now.
Yes, and the circulating tumor DNA that Dena was talking about, I have spoken about in another episode as a liquid biopsy. And right now it is being used in some settings more for after they get diagnosed to see if there's a recurrence or things like that. So stay tuned for that.
That's another one. Yeah. So there's actually two. There's one that's personalized to somebody's tumor, and then there's another one that's just screening in general for tumor DNA.
Oh, okay.
Yeah. And so that's it's really interesting. And then there has been a boom in the companies and the way they're like their technology. And there's actually another company I'm actually on the medical advisory board of that's doing very early testing looking at RNA methylation for preeclampsia risk. So it's predicting preeclampsia risk in a way that is much better than the standard of care. So there's just a lot of really cool stuff out there.
A lot of really cool. I do hope, though, with the basic screening for populations that we think about that. One of the episodes I talked about is younger populations getting cancer, and we see in the 30 to 4-year-old. And I diagnosed a 34-year-old who just happened to be part of a study, and she was doing the rectal screening through Cologuard, and it was positive. She got a colonoscopy, had one polyp, and that polyp had everything: the tubular adenoma, high-grade dysplasia, and invasive cancer. And so I was just wondering, like, wow, if she didn't have that, we would have missed it. So I do really think we need to start normalizing or making it more available that we do some type of population genetic screening. So I hope that happens. I know there's groups that are doing it, but I hope that everyone has access to it. Because a lot of people don't know about it, but now you all do. Now you do.
Yeah, definitely.
Yeah. Well, thank you, Dena DNA. If you all do not know her or follow her, all of the information will be in the show notes. But I do want you to tell listeners where they can find you, Dena.
Sure. So just so you know, my name is spelled Dena, DNA. And so I go by DNA, DNA. Dena DNA.
It's cute.
Thank you. And it is, I'm on Instagram and TikTok, and now I'm kind of starting to do YouTube more. And yeah, so you can find me there. I'm always, my DMs on Instagram in particular are always open. So if you have any questions or you need help finding a genetic counselor near you, there's a website called findageneticcounselor.com that can help you find one if you want to self-refer. Yeah, it's really good.
We'll put that in the show notes as well.
Perfect. Yeah, so that's a really great option. And then my clinic is called Malibu Genetics. So if you are interested in seeing me, I can see patients in, I can't remember how many states, like 13 different states. It says on my website, but I can see patients through telehealth. So it's malibugenetics.com. And so I have lots of information online, and then I'm happy to help you find a provider that can work with you.
Great. Well, I hope to have you back on. If you have questions, you can always send them to the Medical Collective on our social media platforms, and we'll make sure that we get them answered with Dena DNA, or you can reach out to her directly. But I implore you all to have a great time. Enjoy your days and lives, but I think that we became smarter today when we talked about genetic testing and counseling as well as many other things. But to be honest, it's something we don't talk about enough. And every conversation I have with someone, we talk about cancer or disease or what have you, or the pregnant person, it's missing that we don't understand the importance of counseling and screening. So I appreciate you. We both have our microscopes up. I appreciate you, Dena DNA, and I hope to see you again. And for the listeners, next time, please listen to a previous episode. It was called Misconceptions about Pathology. That was a great episode, kind of like the misconceptions we talked about today with DNA testing, genetic counseling. So everybody have a great time. Until next time. Thank you. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates. And and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.